Kostas Danis is an epidemiologist for the Santé Publique France. He joins us now. Kostas, thanks very much for speaking to France 24. Now, you're the leading author of a recent study on COVID-19 and children. I mean, a straightforward question to you. Is it safe to send children back to school?
Well, of course, this depends on the epidemiological situation in this country. What we saw in France, what we saw in our study, is that we investigated the first clusters in France, in the French Alps. An infected person a person infected in Singapore came to France for a holiday, and he infected 13 other people, a very high number. Among those, there was a child, a 9-year-old child, who developed mild symptoms. He continued going to schools, to 3 schools and a ski club. And we identified 172 contacts for him. We tested all the contacts and we followed up all the contacts for 2 weeks, and we didn't find any contact positive for coronavirus. So we think that it is certain that he did not transmit the disease, although he had contact with too many people and too many school children. We think that this is consistent with what we observe so far, with the evidence that we have so far. We know that children, there haven't been many cases in children. We know all over the world that only about 2% of the cases were diagnosed in children. We know that children develop very, very mild disease, so severe clinical manifestations are very, very rare in children. In some countries where where a lot of tests were done, like, for example, in South Korea or in Iceland, the infection rate in children was lower than the infection rate in adults, suggesting that probably children might be also less likely to be infected.
Okay.
We've seen...
What are we to make then of this? We're hearing over the last few days about this Kawasaki disease affecting children, which scientists say is probably linked to coronavirus. It's early days. How worried should we be at this stage?
Well, this is a disease that we know already. It can be a complication from many other viruses. It is a very, very rare complication, and I think it probably is. We need to monitor the situation closely, but it is likely that it will remain a very, very rare complication, even for this virus.
OK, I mean, let's come back to this question of, sending children back to school, given the studies and what studies have come out of. One would imagine that social distancing there is going to be key. But how do we ensure that children, certainly those of a young age, I mean, here in France, those who are in the maternelle or primary schools will go back. How can we ensure that social distancing is going to be kept in place?
Well, there can be several measures implemented. First of all, they can have small groups of children. I think this is good. This is what they're planning to do in France and also in many other countries. Children can sit in a distance, so in small groups and in the distance. They don't have to have access to the other classes, and maybe the timetable, the time can be shifted so that to make sure that not so many children are at the school at the same time or at the class at the same time.
OK, so smaller groups are certainly what scientists favour if, parents do decide to bring their children back to school. Kostas Danis speaking to us from here in Paris. Thank you for your time today.